guys, it's Dr. Truesdale, and we want to do something a little bit different today. So we all know that I'm a plastic surgeon and I'm busy. I'm in the operating room a lot. Unfortunately, I don't have time to always get to the comment section and respond to you guys. But my social media manager has been able to kind of compile a bunch of different questions. So I'm going to answer you guys. And so I'm going to read the question and give you my take. So let's start. All right. So Live Life says, how do people manage to fund something like this? I love the transformation. I am so happy for this lady. Even though I don't know her, Dr. Truesdale's skill truly shines through. He's clearly passionate about his work. I'm not questioning people's choices in spending on this. I'm just genuinely curious how they're able to afford it. Perhaps they're in a strong financial position or have set aside savings specifically for it, or maybe he doesn't actually charge as much as we might think. And we're limiting ourselves by assuming he's out of our budget. That is a great question. And I think most people are wondering about that because let's be honest, we live in a world with dollars and cents, right? And times have not been easy for everyone. And you're right, I am definitely not cheap. I am not the most expensive plastic surgeon, and I am definitely not the most economic. But when we're thinking about plastic surgery, right, especially the type that I do, it's your face. And so it's very, very important. What you get is what you pay for. And there are very great surgeons who don't charge as much, and there are really great surgeons who charge more. Really what it comes down to at the end of the day is I have these two hands, and I have to use these hands to make the people who come to me look as beautiful as I can. And a lot of that has taken me years, my whole life, to know the medicine and to have the understanding to do it. The other side of it is, for me to do what I do, it needs to be done artistically. It needs to be done amazingly. And a lot of times, there's not an easy way to put a price on that. So it is not cheap. And how do people usually afford it? Well, some people just pay in cash. Some people have been saving for a lot of time. Some people are just very, very wealthy and just have the money and they're not really even thinking about it. Some people finance. So we do have 4 patient financing options. So some people might put down some credit cards, some with a finance, and some rest of it, they just pay down. The great thing about the financing is some of the terms are really good, so people can pay over time. So everybody's position is a little bit different. You know, your budget might be different than a friend's, but ultimately, I don't do what I do for money. I need a job, I have to pay for my staff, but I would do what I do for 10% of what I make because I love it so much and because I get to go along the journey with patients. So if you are interested in a procedure and you don't know how much it costs, call my office. One of my patient care coordinators can go through the cost with you and figure out how we might be able to make it work. And if we can't right now, maybe we can figure out how to do it in the future. I'll see you soon. Question number 2, why is looking old considered something you need to fix? This is from Susan Sheldon, 2033. I don't consider it something that we need to fix. In fact, the way that I approach plastic surgery is that you don't need to have it done. So plastic surgery can be broken down into 2 different types. One is reconstructive and one is cosmetic. Most of what I do is cosmetic plastic surgery. And from that perspective, you don't need it done, right? If I'm building someone a new face after a trauma or domestic abuse, or maybe a young child who can't smile because of some congenital issue, that's a different scenario than me making someone look 20 years younger. Now, I don't think that it needs to be done, right? It's like going to the candy shop. Who really needs candy? But it does make your life better. And I see this every single day. People come in, maybe they feel a little self-conscious, they don't like the way they look. I do my surgery, their confidence grows. Every other aspect of their life gets better and better and better. And so even though it's not something that you need, it definitely is a want. And when I help satisfy that want, people feel better. That's my approach. All right, so we have D Jones, 5420. I wonder how his dad feels about his wife's new look. Does he want to look youthful again too? So you may or may not know I did my mom's facelift, brow lift, upper lift, fat transfer, skin pinch lower, and lip lift about 2 months ago now. And she looks amazing. It broke the internet. And my dad has not had any work done. He's very, very happy for his wife. They've been married for as long as I've been alive, and basically they're there to support each other. My dad is very against blood. He doesn't like blood. It makes him queasy and weirded out. And I made him become her nurse in the post-op. So cleaning her incisions, draining the tube and the blood. So he had to kind of get over that, which I got a little bit of a kick out of. But he's really happy for her. Now, she does look like he robbed the cradle now because she looks significantly younger. So inside, I think my dad would probably want a procedure done, but I don't know if mentally he's there to have a procedure because he's just so kind of squeamish about things. The other aspect, right? I worked on getting my mom as healthy and as optimized as possible before surgery. And, realistically, I would want to do that same thing for my dad. We've made a lot of progress in terms of how healthy he is and those kind of things. But for the amount of work that we would want to do, especially given that he's a man, it's more complicated. There's more risks, right? In terms of hematoma, we could totally do it, but he would want to have to show me that he's really interested. And right now it's more of like I wonder, what would you do for me type question. So stay tuned. I don't know, maybe I'll do my dad's surgery in the future. All right, our next question. Why don't the stars come to you? Make it make sense. No one would know if we didn't see this. How are we gonna know? We wouldn't. This is from CPS 2547. You're right. And believe it or not, some stars do come to me. And so if you start seeing people look inappropriately young all of a sudden, it might be me. All right, so JOUE1515 asks, try cucumbers. You are young. In 25 years, you will sag. I'm not quite sure what this one means. I do like cucumbers, but eating cucumbers alone will not make you that much younger. Cucumbers will not make your bags go away. Cucumbers can help refresh and give the eye a good feeling. It might reduce a little bit of swelling if they're chilled, and that actually constricts the blood vessels and helps with a little bit of the puffiness around the under eye. But if you really have fat herniation and a tear trough deformity or excess skin, cucumber's not gonna help. You gotta come see me. All right, our next question is from Gumbo Farms, Gumbeaux Farms. Surgery ? Wouldn't a good concealer or change of diet have worked here? She seems much too young for a surgical route for such a tiny flaw. She's gorgeous. Well, thank you for complimenting my patient. And I'm not sure which patient you're referring to with this question, but the way that I approach plastic surgery, there is no perfect age for surgery, right? You can be young, you can be old, and as long as you're healthy and have something that can benefit from it, then it can work for you. You just have to understand the risks, the benefits, and have a realistic expectation, right? So a change of diet a lot of times will not accomplish what I do with surgery, because when I'm doing what I'm doing, I'm actually dealing with laxity, right? I'm dealing with things falling, right? A diet will help you lose volume, but when that happens, you might actually look a little bit more loose. So a lot of times just losing weight will not make a person look younger in the same way that I do. Because what I'm doing is I'm lifting the muscle layers up. A lot of times I'm adding fat back to the face where it's lost it. So it's the opposite of what happens when you are on a diet. Now, when you are on a diet, the face can look more slim, more trim, more contoured. And I do that too when I'm doing my procedure, but it's not exactly the same. I'm always an advocate for a healthy diet and exercise, but sometimes you need a little bit of boost, and that's where I come in. All right, we have Adeyink Ayobedeme 4008. Hopefully I didn't, just butcher that. But we said, how do we manage skin with a tendency to scar badly, doctor? ? I'd love to do this, but I'm terrified I'd get horrible scars. Great question. I do a lot of things to make sure my scars are as optimized as possible. That starts with the decision to cut. Sometimes we don't need to cut. Sometimes we do need to cut. If we do need to cut, let's try to hide the scar in an area where it's not going to be visible, in hair, inside the ear, or completely behind the ear. Now, if we have to make a scar and we have to put it somewhere that is possibly to be seen, it needs to be closed with the utmost of finesse. No tension, no pulling apart, a monofilament non-dissolvable stitch that's as thin and as small as possible, good skin reapproximation. We really want to make sure that everything is oriented nicely and lining up perfectly. Now, if someone has a history of keloids, then sometimes we'll add on a little bit of the external beam radiation to make sure that we quiesce down those cells that want to lay down too much scar. So each person's a little bit different, but I use a lot of special fancy plastic surgery techniques to make sure I do not give you a horrible scar. Next question. Is it unethical to operate on loved ones? Question mark, rhetorical. This is a very great question. So a lot of people ask me about this, but I will defer this question for actually season 2 of Beyond the Surface, where I'm gonna dive into this. If you haven't seen, or if you have seen me do my mom's surgery, I'm actually gonna talk about this whole process. You'll hear from her, you'll hear from me, and the complex decision-making that I use to figure out, should I do my mom's facelift? I don't know what number this is, but we have another question from Anita Simangis 5449. As a woman with cool sideburns, is there a way to get a facelift but keep your sideburns? Absolutely. Most of the time, I'm not moving or changing your sideburns at all. That really depends on how the incision is placed in what we call the temporal tuft. If the incision is placed trichophytically, meaning just inside the little baby hairs of the sideburn, then actually all the skin gets moved over the sideburn and trimmed away. If you put the incision in the hair behind the sideburn, then as everything gets lifted, the sideburn is going to move. So most of the time I'm leaving the sideburn exactly where it is, but great question. Carmen San Diego 7749 says, but what can you do with women with really sensitive skin who don't fare well with surgical scars and stitches? It's a very similar question to the question that Adeo made 4004 asked me. And so I'll just refer you to that answer. All right, so Deanna Valdez now asks, now what happens if she loses weight, which she should have done before having the surgery? I never understand why people have facial surgery before losing weight. Wow, you are quite judgmental, my friend. I'm gonna just take a pause and just leave it there for a second. We're just gonna marinate on that. I am not in the judgment game, right? Now, there is something to be said for making sure that your weight is optimized before surgery, because that influences your healing, your health, and your other medical comorbidities, which might influence your risk profile for surgery. Now, if your BMI is in an acceptable range, then it's up to you and the doctor to determine when is the safest time for you to have a procedure. But I do agree with you, because if a person has significant weight to lose, or if they plan on losing this weight and it developing more laxity in the face, then by all means, they definitely should try to get to as close to their ideal weight as possible. Usually I tell people within about 10 to 15 pounds from their ideal weight, or about 10% of their ideal body weight. And you want to be there stable as long as you can. The reason why I say this is because when you lose that weight, they just become looser. And I want to lift the face when it is as loose as possible. So you're right, if a facelift is done, even if it's a deep plane facelift like I do, where I'm lifting up the muscle layer, if the face then loses a bunch of soft tissue on top, or fat, right? The skin overlying the muscle will probably need to be retucked after the surgery. So it really depends on your specific face, on your specific need, because it depends on, are you gonna lose that weight in your face, or when you lose weight, do you lose it in your thigh, right? How far away are you from your ideal weight? How realistic is it for you to actually get there? Let's be honest, a lot of people have a hard time losing weight and keeping the weight off. So say your BMI is about 30 and you know, listen, doc, I would love to lose another 50 pounds, but I don't realistically see myself getting there. Let's make a compromise and say maybe we get another 20 pounds of weight loss. We get you there stable for a couple of months, and then we just plan to lift your face, because we know we are not going to realistically be able to get you that 50 pounds off. But I do know that your face will look significantly better because you have laxity to justify your facelift right now. So it's really complicated. Great question. Calm down a little bit on the judgmental aspect, but listen, great question. I agree, but I also disagree. Sleepless OC says, Dr. True, I like that, TRU. I'm not trying to sound insulting here, but why didn't you remove more underneath her chin so that the area would have looked more defined? Don't get me wrong, she still looks stunning after her procedure, but I can't help thinking a little more could have been removed. I know how hard it is to strike that balance of improved looks, but still natural looking. So I am thinking you were erring on the side of caution here. Great question. Now for this particular patient, some of the fullness that you're seeing under the chin actually would require a little bit more surgery. Now, in this case, I actually did her surgery completely awake. Now, when I'm doing that deep layer where I'm removing that fat, which I did do for her under the muscle, I'm also have access to remove the glands. I do not do that with people awake. And so in this situation, if we wanted a little bit more definition, we actually would need to go to the operating room. patient did not want that. And so I can only get the result for the anatomy that I have to work with and for the goal of the patient. The patient is perfectly happy and is really, really happy with her result. I always ask people, to what level would you like the result? Do you want a statuesque Greek god jawline made of stone? Or do you want an improvement? Do you want to look like what you used to look like? Because a lot of times I make people look like what they used to look like, which is refreshed and more youthful. Now, sometimes when I do the extra things that I do, I give them jawlines that they've never seen. And so each person, it depends on what I can get out of that clay. As the sculptor, as the artist that I am, not every single neck, every single face is the same. It's a snowflake, and it really depends on what that person wants. Great question. Okay, guys, so we just wrapped up a bunch of different questions. I love these questions. I wish I had more time to answer them down in the comment section, but if you liked a session like this, comment below and I'll do another video just like this where I'm responding to some more questions. Really good educational content here. If you guys like this, be sure to show love. Thank you so much for consuming my content, joining the Beyond the Surface series, watching all the beautiful before and afters that we show. Really, really excited, guys, and we'll see you soon.